How's it going, Barry?
It's going very well, thank you. The operations is definitely done well, and I can see a lot more after the operation, so it's so much better.
Yeah, I wanted to ask you to talk about amblyopia, or the lazy eye, and how it impacted you in childhood.
As a child, it really affected my schoolwork and how I done things at school. So I was quite naughty at school because I couldn't see the blackboard properly, and it's only when they discovered I had a lazy eye that they started to do something about it. So they covered one eye up for quite a long time.
So they patched your good eye, which is your
they patched my good eye
which is your right eye.
Yeah, and to get my left eye to work, and it helped. But it was always not the lazy eye.
So you got to a point you could drive, and it was fine, and then you met some laser surgeons.
Yeah, I met some. So in I think it was around 2004, because I had poor eye vision, I decided to go for laser surgery. And it was done at a big hospital in London, and they'd done laser eye surgery on both eyes. I was a very high prescription, it was -6.5. So at the time it was along the lines of how far they could go. I was pretty much as far as they would attempt to do. When they done it, it was a massive improvement.
In both eyes.
In both eyes.
Wonderful.
I had to go back after, I think it was 3 months, because I had to go in again for night vision problems. So I had good day vision, but night vision I had very bad starburst. So they went back in and redone it after 3 months. And then 5 years later, I think it was 5 years later, the night vision failed again. And they went back in and redone it, but I believe that was on the front surface of the eye at that time.
Yeah, so that's why the calculation from your lenses are really quite tricky. But something unfortunate happened with your right eye, your good eye, your preferred dominant right eye.
Yeah, so my right eye eventually, I had what we call a floater, a black dot, and I had a thing called a vitrectomy, and they'd done the vitrectomy, and there was a problem after that surgery, and my right eye retina detached. So they reattached it in an emergency operation, but it hasn't gone back very well.
Yeah, so now there's a constant conflict with your right dominant eye.
Definitely.
And we have finally caught up with the left just overtaking the right. And our idea is to use Revital Vision, which is the neural adaptation training program, to cover your right eye, and we're repatching the other way around again.
I'm so looking forward to get this.
To lifting up your left eye vision. So you're 6/12. The prescription is still very fixable, which we will work with your optometrist to do.
Thank you.
And then we will see you in 6 weeks when you're about halfway through your Revital Vision training. And then, a full complete success if that takes over, and we can make your left eye dominant.
Thank you so much.
I
am so pleased with everything that you've done for me. You've been absolutely amazing.
Thank you so much for trusting us and my team.
Thank you. And the team are all lovely.
So you are essentially our, this is what we do. This is how we look after our complex patients. When you only get the one chance, you can trust us with it, and we will look after your clients.